Come on in here. You just have a seat here. I'm Erin.
I'm Wendy.
Hi, nice to
Hi.
meet you. How
Nice
are
to
you?
meet you. I'm okay.
Let's just get in here. It's good to meet you.
Nice to meet you.
I guess you were in my secretary's office earlier, and she had you fill out a whole bunch of screenings.
Mhm.
And that's a lot of questions. So I have the results of all that here. And I'm gonna just take a peek at it, and then I'm gonna have to ask you a lot of questions. Some of them are gonna be kind of similar to the things that you filled out on the screening. So forgive me for the redundancy. It's just basically to get to know you and kind of figure out what's going on.
Okay.
All right. You can stop me at any time. There's a ton of questions, so don't worry. There's no right or wrong answer. If you don't feel comfortable answering anything, that's fine. Or if you have any questions about anything, just let me know. Can you just tell me a little bit about what brought you here today?
I've always had anxiety, but it just has gotten way worse lately.
Okay.
I don't know. I just am having a really hard time.
Well, tell me a little bit about yourself.
I have two boys. They recently went away to college. My husband he runs a construction business, and I just feel overwhelmed. Like everybody expects me to do so much, and I feel like I don't have time to do it.
Okay. When did they go away to college?
About 8 months ago.
Okay. Has anything else besides that changed recently? Anything with the business or your health? Anything like that?
No, nothing's changed. I worry about everything, but nothing's actually changed other than the boys went away, and now I just feel like I have more time to think about things and focus on things that make me worry.
Okay. They were living in the house with you before they went away? Okay. How old are they?
They're 18 and 20.
Okay. So all along you've kind of been taking care of them, and now they're gone.
Yeah.
Okay. Has that caused you more worry?
Yeah, I worry about them all the time. If they don't call, it makes me anxious. I don't know if it's reasonable, but I feel like they should call me every day and tell me what's going on, and I'm just used to having them in my house, and now that they're not there, I feel like worried about them all the time.
Okay. Anything else? Any losses or any problems with your health recently changed?
No.
Okay. Any new, besides that, any other new stressors as far as new things that you have to be responsible for?
No, nothing new. The same responsibilities. It's overwhelming me more.
Okay. You said you've always had anxiety?
Mhm.
When do you think it started?
As long as I can remember. I don't ever remember not having anxiety.
Okay. Do you ever have periods where you don't have it, or it gets better, or it gets easier?
Not really. I mean, I've had good days and bad days, but there's never been a span where I don't feel anxious.
Okay. What does it feel like? Can you just describe like some of the things that you worry about?
I worry about the boys constantly. I worry about my health. I worry about my husband's health. I worry about the news. Everything just makes me worry. I don't like to drive, especially if it's to new places. Mainly the boys though, and our health. All of a sudden, I'm really worried about everybody's health.
Okay. Do the boys have any health problems?
No, they're healthy.
Okay. Has this had an impact on your life, like where you can't do things that you could do before?
I'm not sleeping much at all.
Okay.
Actually, my husband, that's part of why I came. He's starting to get annoyed because I'm not sleeping. I'm talking all the time. He's just annoyed.
Okay. When was the last time that you felt okay? Like you didn't feel super worried.
Probably about 5 years ago.
Okay. And when would you say that it got a lot worse?
It got a lot worse when the boys went to school.
What would you say that your biggest fear is?
I don't know what my biggest fear is. I just worry about everything. I don't have one thing, I guess, that I worry about more than others. I just worry about everything.
Okay. Are you able to control it?
For the most part, but I have had panic attacks. I don't have them regularly, but I have had them in the past.
Okay. Does anything make the problem worse?
No, it's always there.
You said driving sometimes you'll set you off. Or...
Oh yeah, driving definitely, especially in a new place. If I don't know where I'm going, it just really upsets me.
You worry like you might get in an accident or you might get lost or...
I worry about all of it. I worry about getting lost. I don't like busy traffic. I don't like not knowing the roads. All of it.
Does anything help you with it? Like, does anything relieve you or make it feel better?
While driving, no. Just getting somewhere familiar or whatever. But otherwise, not really. I just get through it, and whenever the situation ends, I'm okay.
Okay. And you said that you had a panic attack before.
Mm-hmm.
Was that from driving or?
One of them was while I was driving. It was a really busy area that I wasn't familiar with, and I just freaked out. The other panic attack was when one of my boys the school had called and said I needed to come right away, and it was a message, and I didn't know what was going on, and I had a panic attack until I got a hold of someone at the school.
Okay. What was it?
It was nothing. He had a fever, but they didn't tell me in the message, and it scared me.
Yeah.
Until I got there.
Are they far away, or are they?
They are. One of them is 6 hours away, and the other one's 10 hours away.
Oh wow. Okay.
Driving.
Mm-hmm. Have you had to drive out
Mm-hmm.
there by yourself, or?
Yeah, it's hard for my husband to get away because he runs the business, and he really can't get away much. And I worry because I feel like I shouldn't go either, and
yeah,
just makes me worry.
Okay. When you've had panic attacks, do you ever have fear that you might have another one, like when you're driving, or?
Mm-hmm.
Yeah.
All the time. The only places I even want to drive anymore are to go see the boys, and that's the only motivator that makes me do it.
Okay. So I guess you've like changed your behaviors as a fear that you might have a panic attack.
Mm-hmm.
Okay. Have you ever woke up in the middle of the night having a panic attack?
No, not in the middle of the night. But I haven't really been sleeping. I feel like I'm just in a constant state of worry at night anyway. Not a panic attack, but I'm worried all the time at night.
Thinking and tossing and turning.
Yeah, I feel like I just can't really shut my thoughts down.
How are you in like social situations?
I always worry about what other people think about me. I don't mind social situations, but I constantly worry that people are judging me.
Mm-hmm. That's hard.
Yeah.
Besides the driving, do you have any specific phobias like bridges or bugs or flying, anything like that?
No.
Okay. What is your, I guess basically, what is your goal for coming here today? What do you think that maybe we could help you with?
I don't know. I just feel like I need something to help me not feel like this all the time. Okay. It's just gotten worse, and like I said, my husband's starting to get aggravated by my behavior, and he's the only one left in the house now, so.
Okay. Have you ever been diagnosed with any kind of psychiatric disorder?
No, I've really not seen anybody for anything because I don't want to take medicine. I just feel like I need to talk or
Okay. So you've never been hospitalized overnight?
no,
No. Have you ever seen a counselor?
no,
Um, have you ever been in a detox or rehab for any kind of substance use?
no.
Okay. So now I have to ask you a bunch of questions, and these are just about different disorders. It's kind of to rule out anything that it might not be. Um, looking at the forms that you filled out, it looks like what you said was the main thing was anxiety. You did answer a couple questions about having some depression, and a couple questions about having some like obsessive thoughts. But basically, we're just gonna ask all kinds of symptoms just to make sure that we don't miss something, and ask a lot of questions about your physical health as well. So some of them might seem kind of funny or totally not related, but it's just to make sure we don't miss something. So have you had any feelings of depressed mood?
Sometimes.
Okay. Any feelings of guilt, worthlessness?
Yeah, I feel guilty like I can't keep up with all the demands in my life.
Okay. Um, how do you feel as far as like your self esteem? Like do you feel like good, or do you feel sometimes like worthless?
I wouldn't say I feel worthless, but I do feel like people don't see me like I want them to.
Okay. Um, how's your concentration been?
Not good. It's getting worse. I can't concentrate as well as I used to on anything.
Like, what do you normally have to concentrate on? Like, what are your tasks that you have to get done?
Well, I normally help my husband with the business, but lately I just noticed that when I'm trying to do the paperwork or focus on what I normally do, my thoughts just deviate and it takes me much longer to do tasks that used to take me 10 minutes now take me 30.
Okay. Have you slowed down, besides like your concentration, but have you slowed down like your normal, like how fast you do things physically?
A little.
Like as far as like, cleaning the house or getting to the grocery store or things like that?
A little bit, yeah.
Um, do you have any feelings of hopelessness?
No.
In the past, have you ever thought of wanting to hurt yourself or end your life?
No.
No. Have you ever had any kind of an attempt like that?
No.
And you never thought about it?
No.
Okay. Have you ever in the past had any kind of like cutting behaviors? Some people like when they feel bad inside, they cut themselves to make themselves feel better. No. Okay. How about problems with an elevated mood? Do you ever feel like really up?
Sometimes in the past, but not really.
Okay. Have you ever had like weeks go by where you feel like you don't need any sleep and you just feel like really up and in a good mood and
No.
have a ton of energy, anything like that? And ever do any like high risk behaviors or high risk sexual activities, anything like that?
No.
Ever have racing thoughts?
No.
Do you ever have intrusive or persistent thoughts?
Yeah, sometimes. I get really preoccupied with the news and stuff like that. I just worry constantly about anything that they put on the news. I tend to worry about way more than I should.
Okay. Do you sometimes feel like these thoughts are irrational?
Sometimes later, but at the time they seem very real.
Okay. So it's hard for you to just say that's not going to happen and step back. Okay. Do you ever have to do any repetitive behaviors like washing the clothes over and over again, or washing your hands, or any kind of like counting or checking things like the stove or?
I am kind of preoccupied with cleanliness. I do wash my hands a lot. I don't like there to be loads of clothes in the hamper. I like everything to be clean.
Mm-hmm.
But other than that, no.
So when you say that you're having trouble completing your tasks, do you ever have trouble like completing your cleaning or your house duties?
No, it just takes me longer than usual.
Okay. Have you ever experienced any kind of a trauma or an event where you got hurt or you felt like your life was in danger, like an accident or a natural disaster, a robbery, anything like that? Any kind of trauma?
No.
Okay. Do you have dreams or bad nightmares about things that have happened in the past?
No.
Do you ever feel like really on edge, like aroused, like because you're scared?
Sometimes.
Does your mind ever play tricks on you? Do you ever hear voices or see things that aren't there?
No.
Do you ever feel like things are different than they maybe are in reality?
No.
Do you ever feel paranoid?
No.
I know you said you worry a lot about what people think of you. Do you ever feel like they're talking about you?
Sometimes.
And then I know you said you had trouble sometimes watching the news. Do you ever feel like the news is trying to tell you something, like something bad's about to happen?
No.
Okay. Do you ever feel like you have any special powers to change the way that things happen?
No.
Okay. When you've had these panic attacks, do you ever have with them, how does it feel like when you have it?
I feel like my heart's racing. I feel sweaty. It's hard to breathe.
Okay. Do you have chest pain?
Not really, just more of a tightness.
Okay. Any numbness in your extremities?
Not that I've noticed.
Any nausea?
No.
Do you feel like a fear, like you're going to die or have a mental breakdown?
No.
Have you ever felt like you're out of your body, or kind of like things aren't real around you?
No.
Okay. So you did answer a lot of the questions already about the anxiety, and you said it's been going on for about 8 months. You said that you have excessive worry, you're restless. Do you feel edgy?
Sometimes.
Do you feel irritable?
Mm-hmm.
Is that because you're not sleeping, or?
I don't know, probably a combination.
Okay.
Just being worried and tired.
And then you feel fatigue, and that might be because you're not sleeping as well.
Mm-hmm.
Or maybe just because you're worn out from worrying.
Maybe.
Do your muscles ever tighten up?
Yeah, I have a lot of just soreness, muscle aches, and everything just hurts.
So when you lay down at night, like what time will you go and lay down?
Usually around 10 or 11.
Okay. Is that when your husband goes to bed?
Mm-hmm.
And then do you just lay there, or?
I lay there and then I start to think and then I start to worry and then I'll get up and kind of pace around, lay back down. It's up and down all night.
Okay. Do you ever eventually fall asleep?
Not for long. If I do fall asleep, it's mostly for an hour and then I get up and back to being anxious.
Okay. Has your husband ever noticed any unusual behaviors in your sleep? Like, do you sleepwalk or have trouble breathing when you fall asleep?
Mm-hmm.
Nothing like that. How long has the sleep been going on, the problem with the sleep?
I would say since the boys left the house, it's been way worse. I've never been a great sleeper, but it's been way worse since they left.
Okay. Before that, would you get more sleep every night?
Mm-hmm.
Okay. And you said that you don't mind social situations. So what kind of social situations do you usually find yourself in?
Well, I usually take the people that my husband works with lunch or whatever. There's company parties, there's things that we do all together, and those are the main social situations, and they just kind of make me more uncomfortable than they used to. Also, when I have to go to the boys' schools, if there's an event that takes me there, I don't like being around the other parents. Really, I'm always worried about what they think about me.
Do you worry about like the planning for the events, like the parties and things like that? Are you usually in charge of that kind of stuff? Because I mean, you said you did a lot for the business.
Yeah, that's usually what I do to help them out. And lately, I just feel like it's harder.
What do you like? What kind of things do you worry about in those situations?
That something will go wrong, or people won't like what I've organized. Just that kind of stuff.
So like kind of like fear of embarrassment or humiliation, criticism. Okay. In how would you say that your relationships are with other people? Do you have friends or social network?
Some, I don't see them much, but I have some friends.
Um, how would you say, like, a lot of times people, like, in their lives since they've been young have patterns of relationships? Would you say that you've been able to maintain relationships, or do you have trouble with relationships with other people?
No, I can maintain them. I just probably don't talk to them as much as I should.
Were a lot of your relationships because of your kids, and now that they're gone, they're not around as much, or because of the business?
A lot of it's just knowing other moms from the boys growing up or whatever, and now that they're gone, we don't have a whole lot in
Do
common.
you ever have fear of rejection or abandonment?
Rejection, yeah.
Do you have a feeling of emptiness inside?
No.
And you said, how would you describe your self esteem?
I would say it's pretty poor.
Do you have mood swings? No.
Not really.
Ever have like intense anger or outbursts?
No, I'm just a little more irritable than usual.
Okay. Ever have any kind of self-damaging behavior, like when you're irritable, like get yourself into trouble?
No.
No impulsive kind of stuff?
No.
In the past, have you ever been arrested?
No.
Have you ever had trouble with stealing?
No.
Or kind of any kind of trouble with the law, bad driving, or anything like that? Okay. Have you ever had trouble getting in fights?
No.
It sounds like you typically are concerned for other safety and have empathy and worry about people a lot, so no problems with that. How do you feel about your appearance?
Okay, I guess I don't worry about that so much as I do other things, I guess.
Yeah, I mean, I know you said you were worried about your health. Is there any particular reason?
No, I don't know why I'm so worried about it. I guess just because I'm, getting older.
Okay. In the past, have you had any kind of like unexplained illnesses?
No.
Or medical problems that couldn't be diagnosed?
No.
Okay. Have you ever had amnesia?
No.
Do you ever forget important details of things that happened in the past, or like heard that something happened that you totally don't remember?
No.
How has your appetite been?
Okay.
Do you eat 3 meals a day?
No, I kind of just snack when I think of it.
Any changes in the way you've been eating?
Yeah, I'm not eating as much as I used to. I don't know why. I don't know if it's because the boys are gone. We don't sit down and have meals. I don't know what's causing it, but I don't really think to eat.
Okay. Have you been on any kind of diet?
No,
Have you lost any weight?
I don't know.
Okay. In the past, have you ever had trouble with anorexia, bulimia, any kind of eating
No.
disorder? In the past, have you ever been victim of any neglect, abuse?
My parents were not great. They never hit me, but I've seen my dad hit my mom.
Is there any kind of like emotional or verbal abuse?
Yeah, they just weren't nice. Didn't
Okay.
say I love you, that kind of thing. They were really hard on you if something went wrong.
Okay.
Kind of parents.
Okay. In the past, have you ever had to have sex against your will?
No.
Any sexual abuse or anything like that?
No.
Okay. And you said you've never really been had to deal with any kind of an event where you felt it was traumatic.
No.
Have you had any significant losses of family?
No.
All right. So now we're just going to talk a little bit more about your family. Is your mom and your dad, are they still alive?
Yes.
Okay. Do they have any psychiatric diagnosis?
My mom had anxiety. I remember her taking Valium
Oh, okay.
growing up.
Did she ever was she ever in the hospital for that?
No.
Okay. Did she see a psychiatrist then?
Yeah, I'm assuming so. 'Cause I know she definitely was diagnosed with anxiety.
Okay. How about your dad?
My dad didn't have any diagnosis. He drank a lot. That was about it.
Okay.
So did my mom.
Would you say they were alcoholics?
Yeah.
Did they use any drugs?
No, just what they were prescribed.
Okay. How about your grandparents, like their parents?
My mom's mom also had anxiety, and she was also prescribed Valium. But
Okay.
other than that, no. My dad's parents didn't have any diagnosis or anything.
Okay. Do you have brothers and sisters?
I have a sister and a brother, but we don't really keep in touch.
Okay. Do you know if they had any psychiatric illnesses?
Not that I'm aware of.
Okay. How about any medical illnesses, like your mom and your dad?
No, pretty healthy.
Okay. And your sister and your brother?
Nothing.
Okay. And do they have problems with drinking or drugs?
No, not that I'm aware of.
Okay. But when was the last time you had talked to them?
I don't know. It's really spotty. I haven't talked to my sister in probably 2 years and my brother in over a year.
And now, were you the youngest or the middle or the oldest?
I'm the youngest.
The youngest child?
Hmm.
Okay. Do your sons have any problems? Any kind of anxiety or any kind of psych history?
Not that I'm aware of.
Okay,
They
so
seem okay.
they've never been in the hospital or anything like that
No.
when they were growing up, and you never go to family counseling, nothing like that?
No.
They never had any conduct problems, behavior problems, learning disabilities?
Nope. They've always been fine.
How about your husband?
No, my husband's fine too. I don't think he even sees a medical doctor much.
Oh, okay. Anyone in your family, has anyone committed suicide that you know of or tried to?
No.
No? Okay. Okay, so now we're going to talk a little bit about your medical history. Do you have any chronic health conditions?
No.
Hypertension?
Oh yeah. I take lisinopril actually for high blood pressure.
Okay. Any asthma, diabetes? Any hepatitis? Any
No.
STDs that you know of, HIV, anything like that? Have you ever had tuberculosis?
No.
Okay. Who prescribes you the lisinopril?
Our family doctor.
Okay. And how long has that been?
I've been taking that for probably 5 years now.
Okay. Have you had any labs done recently?
Probably about 6 months ago.
Okay. Have you had any major surgeries?
No.
Have you ever been in the hospital overnight?
Just when I have my kids.
Okay, no other reason?
No.
Okay. Have you ever had a head injury?
No.
Have you ever lost consciousness? Ever had a seizure?
No.
You ever passed out?
No.
So you probably never had a CT of your head then?
No.
Okay. What other meds do you take besides the lisinopril? Anything?
No.
You take anything over the counter?
Every now and then I'll take a Motrin or something, but
Anything to help you go to sleep, like Benadryl, anything like that?
no, I'm always scared that then I won't wake up if something does go wrong and the phone rings or something.
Okay. Any herbal kind of supplements?
No.
Any vitamins?
No.
Do you have any allergies to anything?
No.
How often do you drink alcohol?
I don't drink.
Never? Not on social occasions or anything?
No.
Have you ever in the past?
I'd have a glass of wine here or there or a glass of champagne, but it's really rare to even be in a situation where it comes up.
When was the last time it happened?
At my son's graduation party.
Okay. Did anything happen that made you stop drinking? Like,
no.
Ever had trouble in the past or kind of get anxious about it? Or...
No, I just really not been something I've ever been into.
Okay. How much caffeine do you drink?
I drink a lot of caffeine because I'm not sleeping, so I get up and I drink probably like 2 to 3 cups of coffee, and then again in the afternoon I'll have a couple of cups of coffee.
Do you drink any soda?
Yeah.
Any energy drinks?
No energy drinks, mostly just soda and coffee.
Okay. So probably like 5 cups a day or more?
I would say more, probably like 6.
What time at night is the last time you usually stop?
I usually won't have any caffeine after about 5 p.m.
Okay. And you said you smoke, right?
Yeah.
How many cigarettes a day do you smoke?
About half a pack.
Okay. And how many years have you been smoking?
I don't know, maybe 10.
Has it increased more with the anxiety?
Yeah, it's worse now.
Do you smoke any marijuana?
No.
No. Any other drugs, cocaine?
No.
In the past?
No.
Have you ever shot drugs like
No.
heroin or anything like that? Have you ever taken any hallucinogens like back in the 60s or anything?
No.
No. And you never smoked pot ever, even in high school?
No, I was always scared of drugs.
Okay. Have you had any, before you got married, any high-risk sex partners? Any kind of risk for STDs, anything like that?
No, we got married right out of high school. He's really the only man I've ever been with.
Oh, okay. And he's never really used drugs or had any high-risk behavior like that might be a concern? Okay. Besides the lisinopril, have you ever taken any other prescribed med for a month or more?
No.
Okay. Do you ever take any meds from other people that weren't prescribed to you? Like, do you ever try a Valium with your families or anything like that? Never.
Mm-mm.
Okay. So in general, how would you describe your health?
Good.
So when you worry about it, what kind of things do you think might happen?
I don't know. I worry all the time because I have high blood pressure and I take the lisinopril. I'm constantly worried about like a stroke or a heart attack or just anything, because I didn't even know I had high blood pressure. I went to the doctor and they made me take my blood pressure for like a week, and it was high every day, and I had no idea.
Was your heart rate high too?
No, not bad. And it was over what it should have been, I guess they said, but they weren't worried about that.
Okay. Do you get sick often with like the flu or cold?
No.
No. Now I'm just going to kind of go through your different systems and just ask some more questions about your health. Do you ever have headaches or migraines?
Sometimes headaches, but not really.
Okay. Any nosebleeds?
No.
Have you ever had problems thinking besides the concentration, like just like you couldn't even complete a thought?
No.
Have you ever had any trouble talking, like you forget the words? Okay. How's your vision?
It's okay.
Do you wear reading glasses, anything like
No.
that? If you ever have blurry vision, anything like that? Any problems hearing?
No.
You don't have a hearing aid, right?
No.
How's your teeth?
They're okay.
Yeah.
I don't have any cavities or anything like that.
No major dental work
No.
recently? Okay. Do you ever smell things that other people don't?
No.
No. Can you smell okay?
Mhm.
Okay. Do you ever have like a weird taste in your mouth?
No.
And you can taste your food okay?
Mhm.
Okay. Do you ever feel like you have a lump in your throat that you can't swallow?
No.
When your doctor drew your labs, do you know if he checked for your thyroid?
He did.
He did, and it was normal?
Mhm.
And did you know if he checked for diabetes?
Yeah. He did all of that. I remember seeing it on there and us talking about it. My labs were fine.
Okay. No anemia, no cancers in the past
Nope.
ever? Okay. Did you, when they found out you had hypertension, did you get a EKG done?
Mhm.
Okay. And that was good?
It was normal.
Okay. So you've never had a heart attack, a stroke, anything like that?
No.
Okay. Have you ever had any tremor?
No.
Okay. Any dizziness, vertigo?
No.
Okay. Any changes in your handwriting at all?
No.
Okay. When you have a panic attack, does your heart feel like it beats really fast or
Mhm.
have palpitations?
Yeah, I don't know about palpitations, but it feels like it's going to beat out of my chest. I can feel every move it makes.
Does it feel irregular ever?
No.
And you said that you had kind of like a tightness in your chest when you had a panic attack, but do you feel chest pain?
No, not pain. Just tight. It's hard to breathe.
Do you ever feel tingling in your extremities, like your fingers, your toes, your legs?
No.
Do you ever have swelling in your ankles or your legs? Ever have any problem with your balance, walking, coordination?
No.
Have you, you don't have asthma. Do you have any problems with like persistent cough or wheezing?
No.
Do you ever get sore throats?
No.
You said sometimes with the panic attacks you get shortness of breath. Do you ever experience that if you're not having a panic attack?
No.
So you don't have COPD that you know of or anything like that?
No.
Do you have any problems with heartburn, ulcers? Sometimes when people have anxiety all the time, their stomach gets upset. Do you ever have an upset stomach?
Sometimes, but I don't think it's anything unusual.
So you never have to take antacids?
Not regularly.
Okay. Any problems with nausea or vomiting?
No, sometimes I feel nauseous. If I'm up and worried, sometimes I'll feel a little bit uneasy in my stomach.
Do you ever throw up?
No.
Have you ever made yourself throw up because you felt so nervous?
No.
And now I'm going to ask you some questions about going to the bathroom, so they're a little personal, but do you have any problems with diarrhea, constipation?
No.
Okay. Do you normally go to the bathroom every day?
Mhm.
Okay. Any changes in your stool?
No.
Okay. Have you ever been incontinent of stool?
No.
Okay. Any trouble swallowing ever?
No.
Do you ever, when you urinate, do you ever have burning?
No.
Any like urgency, like you have to go to the bathroom and then you can't go?
No.
Any urinary retention?
No.
Have you had UTIs?
A while ago, a long time ago, but not often.
Okay. Any urinary incontinence, like if you sneeze or just sometimes dribble?
No.
Okay. Do you go to a gynecologist?
Mhm.
Okay. And when was your last menstrual period?
2 weeks ago?
Okay. Do you have a regular period?
Mhm.
Okay, so no signs of menopause, anything like that?
No, not yet.
Okay. Do you happen to know what age your mom went through menopause?
My mom had a hysterectomy actually, so
Okay.
I don't know.
You said when you had the boys, it was both vaginal
Mhm.
births, no C-sections, no problems with deliveries?
Nope, normal deliveries.
Okay. Do you know when the last time you had a pap smear was?
I'm due soon, so probably about a year.
Okay. Have you had any mammograms?
I did. With my regular annual last year.
Okay. Do you do breast exams?
Yeah. I try. Not monthly like they recommend, but I try.
Okay. Any chance that you're pregnant?
No.
Do you use birth control or?
My husband had a vasectomy.
Okay. Have you ever had problems with burning in your sex organs?
No.
Okay. Any problems with chronic pain?
Just muscle stiffness and soreness, but other than that, no.
Okay. Any joint problems?
Not like arthritis.
Okay. How is your skin?
It's okay.
Any open cuts or sores, rashes?
No.
No history of skin problems whatsoever?
No.
Do you bite your nails?
No.
No. Ever pick your hair?
No.
So now we're just going to talk a little bit more about your family and some personal history. Where were you born?
Indiana.
Okay. What did your parents do for work?
My dad he worked in a steel mill, and my mom also worked in the steel mill actually, but she didn't work in the mill. She did the like administrative part.
Okay. Were they ever in the military? Were you ever in the military?
No.
No, your husband?
No.
No, okay. So did you how long did you guys live in Indiana?
My entire childhood, I guess. I moved away when my husband and I got married. But they stayed a little bit longer, and then they eventually moved to closer to where we were.
Okay, so you didn't move around a lot.
No.
Okay. Do you know anything about like when you were born? Do you know if it was a normal birth?
As far as I know, I haven't heard any stories otherwise.
And you said your parents were a little bit cold. It wasn't really a great relationship. Do you get along with them or talk to them now?
I talk to them. I'd say we get along, but we're not close.
And I know you said you haven't talked with your sister and brother, but when you guys were growing up, were you close?
No.
No.
We've never really been close at all.
How much younger were you than them?
My sister's 3 years older than me, and my brother's 6 years older than me, so.
Okay. Were your brother and sister, would you say that they were ever abused?
No, I don't think they were abused, physically anyways. We were all kind of verbally abused.
And your parents were just drinking a lot when you were younger?
Yeah, they both drank a lot, and if my dad was really drunk, I've seen him hit my mom.
I mean, do you think that they're better now? Do you think that situation's better now?
They act like it is.
Do you ever worry about that?
Sometimes I worry about it, but it's just kind of the norm for them. So I don't know. I focus on other things.
Your family
usually.
now.
Yeah.
Yeah.
My kids and my husband and myself. I try not to think about what's going on with them as much.
Okay. That makes sense. Were they religious?
Yeah. I grew up Catholic. We went to church every Sunday and for as long as I can remember. So yeah, definitely religious.
Were your mom and your dad, were they born in this country or were they immigrants or?
They were born here.
Okay. What would you say your culture is? Do you know where they were from? Like, are they European or?
Yeah, my mom is Polish and my dad's Scottish.
Okay. Anything from your culture that changed or influenced your upbringing?
I don't think so.
What how was grammar school for you?
It was okay.
Did you enjoy going to school?
I liked it when I was younger.
Yeah. What grade did you go up till?
12.
Okay. Did you have any learning disorders?
No.
No. Any did you graduate or did you get a GED?
I graduated.
Okay. No college?
No.
Okay. Were you ever in any kind of special classes? Did you have anxiety back then?
I did. I don't think I knew what it was per se, but yeah, I've always been a little bit worried about things that I might not need to be.
Like, say, go back to like when you were 9. What were you like when you were a 9-year-old?
Pretty normal, other than I still was worried and preoccupied, but usually then it was about my parents and their health and our life and how other people perceived us as a family, and I didn't really like to have friends over and that kind of thing.
Did you have friends?
I did have friends, but I usually didn't want them to come into my house. I was worried what they would think about my family.
Okay. Did you have a best friend?
Mhm.
And you said that you really didn't have any kind of behavior problems. You never acted out. You never
No.
Any promiscuity with guys when you were younger?
No.
And no substance use?
No.
Were there any other important adults in your life? I know you mentioned your grandmother earlier.
My grandmother was around. I would say we were close, but she was a lot like my mom.
Like how?
Just always wound up. I don't know. They were both always just, they talk all the time and nag everybody all the time about everything.
Was your grandfather an alcoholic as well?
I don't really remember. He died when I was pretty young, so I don't really remember, and nobody ever really talked about him.
And that's your mom's mom, right?
Mm-hmm.
And you don't know your dad's parents?
No.
Would you say that when you were in grade school that you were like a loner, or were you popular, or?
I got along with everybody. I don't know that I was a loner or popular. I was just kind of there. I would talk to everybody. I did have a best friend, but I wasn't like in a group.
Did you play sports or do dancing or anything like that? Any activities?
I was on the swim team.
Okay. So then when you were a teenager, what high school did you go to?
Portage High School.
How was your teen life?
It was okay. I've always been with my husband, so I think that kept me out of a lot of trouble, so to speak. But
how old were you guys when you got together?
We got together when I was 13.
Oh wow. Okay. So you really didn't have any other intimate relationships with anybody then?
No.
No other marriages, of course, I guess.
No.
How would you say that your marriage has gone?
It's been okay. I don't have any complaints there. That's all we know.
Yeah. You said that he has been more worried about you lately, though?
Yeah, he's definitely worried about me. I'm not sleeping, and because I can't sleep and I'm thinking and worrying at night, I tend to wake him up and want to talk to him about it, and he has to work the next day, and I think it's just starting to get on his nerves a little bit.
What do you think, if he could say what would be best for you as far as treatment, what do you think he would want you to do?
I think he'd like for me to take medication.
What do you think he thinks is the cause of your problem?
I don't think he knows. I don't think he's really thought much about it. I think he's just worried and doesn't really know.
Since you guys got together when you were so young, does he know your mom and her mom? And I mean, does he think that you should do something like take meds like they were on, or?
I think he'd like me to take medication, but not maybe what they took. He knows that I'm really not wanting to take a medication like they took.
Okay. Because it made them impaired. Is that what kind of your experience was with that?
Yeah, I felt like it just compounded their problem with the alcohol.
Made it worse.
Mm-hmm.
Yeah, that can happen. Do you feel safe in your current relationship?
Mm-hmm.
Has there been any abuse?
No.
Any infidelity?
No.
No. Any problems with the way that you guys discipline the kids?
No.
You've always been kind of on the same page with that. And as far as you helping with the business, like since you haven't been able to do it as much, has he been stressed out about that?
A little.
When did you get married? What year was it?
1999.
Do you remember the date?
April 21st.
Okay, these are just some questions to test your memory too. What's your husband's birthday?
March 30th, 1979.
Okay. So now that you're an adult, basically, can you just walk me through like how you spend your day?
I usually get out of bed at about 7. I take a shower. I eat breakfast. I run errands, like if I have to go to the grocery store or pick up clothes from the dry cleaner, whatever I need to do like that. Come home, usually watch a show, and then I take food to my husband's work for all the employees, and then I'll usually help them with the books for a couple of hours, and then I come home and I start preparing dinner. When my husband gets home, we eat. Then we'll usually watch a little bit of TV, and then he'll take a shower, and we get ready for bed, and he falls right to sleep when his head hits the pillow, and I don't.
But it used to be a lot more activities with the kids that would keep you busy.
Oh yeah, when the kids were still living in the house, it was nonstop from about 2:30 on.
They'd have friends over.
They'd have friends over. They were both in activities. One played baseball, one played football. So it was all year round activity, just doing things with them.
Who would you consider besides your husband as your current social support network? Because it sounds like you don't really have your family around.
I don't really have a social support system right now. Now that the boys are gone, I don't keep in touch with any of their friends' parents or anything like that, and that's really been what I know.
How about your husband's family?
They don't live here, but we don't keep in that great of contact with them. We talk to them. They'll send the kids stuff for their birthday or whatever, but other than that, they're not a big part of our life.
Is there anyone that you can talk to about your anxiety?
Not really. I don't like talking to people about it.
Okay, so mainly just your husband. So that's, I can see why he's maybe concerned, just worried about you because you don't really have anybody else to kind of vent to.
No, it's just him, and I think that's part of what's freaking him out a little bit.
Yeah, that makes sense. Do you feel like when you're in a social situation, like with the guys at your husband's work, like with their wives, can you make friends?
I can, but I always wonder what they actually think.
and you're not really in that many situations that are social now that the boys aren't around. Nobody else lives with you, right? It's just you and your husband?
Just us.
Okay. And how often are you talking to your kids now?
I talk to them every day. They might not always like it, but if they don't call me, I call them. I
Okay.
make sure that I talk to them every day.
So your relationship is good with them?
Yeah.
Okay, that's good. Did you ever, besides working with your husband in the business, did you ever work in another job of your own?
No.
Okay. In high school, did you ever even just have like a part-time job or anything like that? Babysit?
I babysat on occasion, but nothing other than that, really.
Okay. Are you on any kind of disability for anything?
No.
What do you do for hobbies?
I don't even have any hobbies. Actually, I don't remember the last time I thought of an idea to do for myself.
Do you exercise at all?
I used to exercise really regularly, not so much anymore.
What did you used to do?
I used to run.
Any kind of like classes or gym or group stuff, something like that?
Not really. I would always do it on my own because I didn't really have the time to set aside every day.
Okay. Do you volunteer at all?
No.
I know you said you watch some TV. Do you watch movies?
Sometimes. Usually just shows.
Do you read books?
Not really.
Do you and your husband travel at all?
Not really.
No. Do you use the internet at all?
Sometimes.
Do you feel like you like to be alone better, or do you like to be with others more?
I like to be alone more.
But when your boys were there, you liked it when they were there?
Yeah, with the kids, yeah. My family, like my husband, I don't mind when he's there or the boys. I just don't like a lot of people at the house, or I don't even love social situations. I tolerate them. They don't bother me, but it's not something I seek out.
Okay. Do you think of yourself as an independent person?
Kind of.
Do you have trouble making decisions?
A little bit.
Do you depend on your husband for a lot of kind of stuff? Because I mean, you guys have been together since you were
Yeah, he's always made
kids,
the big decisions. Yeah, he's always made the decisions, and he's always just kind of called the shots. So I don't really argue with him. So far, he's made good choices. So.
What would you say was the best period of your life?
When the boys were little.
And what would you say is one of your strengths?
I don't know.
I mean, you sound like you're a good mom.
Yeah, I was a good mom.
Take care of the house pretty good.
Yeah. I guess I'm a good homemaker.
How about weaknesses?
I'm insecure.
What kind of stressors have you had to overcome in the past?
Just normal life stressors, I guess. You know, sometimes get a little worried about money, although we've never really been in a financial bind. Just stuff like that, I guess. The boys leaving, just I guess normal things that people go through.
Maybe your family when you were growing up?
Yeah. I didn't really see that at the time as overcoming it. It just seemed like that's what it was, and then when I was old enough to get married and move out, I did.
Yeah, you kind of got out of there.
Yeah.
Yeah. That was your way of coping with that.
Yeah.
I mean, do you think you would have gotten married so young if you hadn't wanted to kind of leave?
Probably not. I probably would have done a little more, gone to college or something, but I just didn't want to be there anymore.
What would you say is the worst thing that's ever happened to you?
Mm, I don't know. I've never really had like a big thing happen.
So when you have these worries, it's just based on the fear that something could happen. It's not because something ever did happen.
Right. It's just worrying about what might happen. Yeah. Nothing major's ever really happened.
In what ways do you cope? Have you ever like had anyone teach you anything about anxiety or looked anything up on the internet?
I've looked it up. For the most part, what I'll try to do is just manage my breathing.
Maybe if you feel like you're gonna have a panic attack.
I'll just take slow, deep breaths, and then usually I can calm down a little bit.
Okay. Do you ever try and talk yourself down? Like tell yourself that, something isn't real or as bad as you might think it's going to be?
Sometimes, but usually that doesn't work for me.
Okay. Do you, when you're really worried, do you smoke more? Okay. Would you say, do you have any goals?
No.
Any aspirations of like things that you might want to do in the future?
Not really.
Okay. Do you think that at some point your husband will retire, sell the business?
I think he'll retire as soon as he can. He's 65.
That's probably like 20 years from now.
Yeah.
So 5 years from now, you see yourself pretty much in the same place that you are now. Okay. Just kind of helping him out and working for him. And I mean, do you feel like you're just gonna feel worried like this forever?
Yeah. Right now, I do.
I mean, can you think of anything that might be able to change that situation?
Not really. It's always kind of been how I felt.
Okay. So I know you said that you were afraid of taking medication in the past. Has this prevented you from seeking help before? Okay. What changed? What made you come now?
My husband's worry.
Okay. So it's pretty much just that. If it wasn't for him worrying, you probably wouldn't have ever come. Okay. Sometimes like if people are afraid of doctors or treatment, they might feel like we have kind of a disconnect. Is there anything that you're worried about that like our goals are different?
No.
Anything that you want to tell me about?
No, I just don't want to take anything that can become like abused or habit forming, or that's gonna make it so I can't do what I need to do during the day.
Okay. So sometimes when you're a new patient, sometimes we will try and just contact, if it would be okay with you, your husband, just to get his perspective on, what he's really worried about. And that would be up to you if you thought that was okay.
Yeah, that'd be fine.
And then another thing that I think might be helpful, if you were okay with it, is if I could contact your general doctor. Just because you are on high blood pressure medicine, there might be something that we could switch that to that might help a little bit with panic attacks and anxiety.
Okay.
And it's not, it's not a habit forming med. It's just a blood pressure med, but it might help both problems. So then rather than add a pill to it, just change a pill.
That would be great.
Yeah, I think that might work. I mean, first we'd have to, kind of talk about it and just see if he thought that was okay. And it would kind of depend on what your heart rate is, because if your heart rate isn't high, this medication makes your heart rate go a little bit lower.
Okay.
But there are just a few more things that we have to ask about, and this is just kind of like general questions about your memory and your mind. Some questions to test that stuff. How would you say that your mood is right now?
Good.
You not feeling depressed?
A little. I always feel a little depressed, but
Do you think that it's because of the anxiety
mhm,
and not really being able to control it?
mhm, and just not sleeping. I just think there's a lot of factors.
Yeah, that would definitely make sense. Um, but no thoughts of wanting to hurt yourself or anyone else. Okay. I'm gonna name 3 objects. I just want you to say them back. Ball, chair, and purple.
Ball, chair, purple.
Okay, and then I'm gonna ask you to repeat those in a few minutes, so just remember it, okay? If you can. And if you get any of these wrong, don't worry about it. People get them wrong all the time. Can you tell me who's president right now?
Barack Obama.
And who was it before him?
Bill Clinton.
And then before him?
Actually, it was George Bush before Barack Obama.
Okay, yes.
And then Bill Clinton.
Yep.
And then George Bush.
Okay. If you were walking down the street and you found a stamped envelope on the ground that was addressed to somebody, what would you do with it?
Put it in the mailbox.
Okay. Can you spell the word world?
WORLD.
Okay. Can you spell it backwards?
DLROW.
Yes. Can you multiply 24 times 2?
48.
Yes. And can you multiply 48 times 2?
96.
Yes. And I'm going to say a series of numbers. Just repeat them after me. 1, 3, 5, 6, 9.
1, 3, 5, 6, 9.
And can you say those backwards?
9, 6, 5, 3, 1.
Yes. Can you remember the 3 words?
Ball, chair, and purple.
Yes. Very good. Okay. If you just pick up that piece of paper there, and then draw a clock on it, and make the clock out to 11:15. And then draw the cube that's already on that piece of paper, and then write a sentence. Great. What is the difference between that clock there and then a ruler?
The difference?
Mm-hmm.
One measures time, and one measures distance.
And so then the similarity would be?
They both measure things.
Yep, great. Can you repeat this sentence? No ifs, ands, or buts.
No ifs, ands, or buts.
And then, have you ever heard the phrase, there's no use crying over spilled milk?
Mm-hmm.
What does that mean to you?
Don't worry about little things.
Okay. That's a good one for you.
Yeah.
Okay, I'm going to give you 1 minute and just say as many words as you can that start with the letter F. Go.
Frog, bunny, frisky. Can't think of many F words. Fidgety. Fantastic. Frolic. Fried. Fidelity. 5.
Okay.
4.
Yep, that's good. That's a bit great. Can you name 5 different cities?
Portage, Gary, Boston, Key West, Tampa.
Great. And now, can you tell me the entire date, like every part of the date, the month, day, year?
April 25th, 2015.
Okay. And what season is it?
Summer.
Where's this place that we are in now?
Like your office or the city and state?
Yeah, no, my office. That's good.
Okay.
It's just that this building is an office building. And yeah, I guess what city and state and county?
Monroe County, Key West, Florida.
Yep. And what floor are we on?
The 2nd.
Great. And then can you just tell me anything that's going on currently in the news right now?
I know there was just a recent plane crash.
I didn't know that. Is that something you just saw last night?
Mm-hmm.
And so when you watch that kind of stuff and then you worry about it, do you worry that another plane is going to crash or?
Mm-hmm. I worry another plane's going to crash. I worry that somebody I love might be on the plane. I worry about all of it.
When you lay in bed and you toss and turn and you're worrying, what are you usually thinking about then?
The boys, mostly. Their health, if they're okay, if they're doing their homework, if they're doing their laundry, if they're doing their dishes, if they're going to class. And I worry about my husband. He should have gone to the doctor again by now. Just that kind of stuff.
All right, so I know this is a ton of questions for the first time that we meet, but we really just like to kind of get like a lot of information to kind of make sure that we don't miss something big, because sometimes medical problems can cause anxiety. In your case, it sounds like most likely you have what's called general anxiety disorder. It ran in your family, your mom had it, your grandmother had it. Doesn't sound like you really have medical problems that are causing it, just because you have had labs recently, you have been seeing a doctor, you're not using any drugs or alcohol, and you've been having panic attacks on top of it. So typically what the treatment for that is, one thing is medication, and then one thing is, support. It sounds like since the boys left, you don't have as much going on to keep you busy, and you don't have a whole lot of relationships or people to talk to besides your husband. So, I would definitely recommend, I can give you the name of a therapist that I recommend that can help you with certain things, like they call it behavioral cognitive therapy. And it basically, you just work on the things that worry you. And you can just kind of talk about it and hopefully curb some of that, especially the panic stuff, because I know that's horrible.
Mm-hmm.
And I understand that you don't want to take, benzodiazepines and with what's gone on in your family. I think that that's good. Typically, they don't recommend you to take those for any long period of time anyway, because they are habit forming, and I just don't think it would be a good choice for you. But I definitely think starting therapy is the first thing. Also, if I could talk to your doctor and your husband, I'll have you sign releases.
Okay.
And I can just maybe get a little idea from them what they think. One of the medications that we could change your blood pressure to is called propranolol. Sometimes people take it before they give a speech. It's kind of like a governor for your heart. It stops your heart from beating so fast. It stops all of those symptoms that you're having, and it just helps your blood pressure. So that's just a simple solution as far as one medication. I think that another thing that you could do is take melatonin at night. It's more of a natural kind of remedy to help you get some sleep at night.
I've heard of it.
Might lessen the agitation. You can get it over the counter.
Okay.
But just the irritability, the agitation, the tossing and turning. It's not anything that has a lot of side effects or anything like that. And it's just more of like a natural way to go.
Okay.
Some other things I think that might be helpful is if you were to maybe join a support group. I don't know how you feel about that.
I could try it.
Yeah. I mean, there are some things that you can do online. It's not always as therapeutic, but if you're having anxiety, it's a way to start. They do have anxiety groups online. You could just kind of see how you felt about it, just somebody to kind of, talk to about what they do, learn some more self-help tools, and then you'll get some more of that stuff in counseling.
Okay.
When you come back, we might want to talk about another medication. I might want to think about it first, but we'll see how you do with the propranolol and the melatonin for sleep. A couple ideas I have. One is an antidepressant, possibly Zoloft. I don't know if you've ever heard of that. It's not anything like the medications your mom took. It's not like Valium. It's something it takes about 6 weeks to have any effect at all. And when it does, it's not something that you feel right away. It just kind of lessens the anxiety over a period of time. It can help a little bit with sleep. It can also help with depression.
Okay.
It can help with some of the compulsive thoughts that you're having. Definitely phobias, things like that.
Okay.
So that's what I'm thinking, but it will kind of depend after I talk to your doctor what he thinks. I want to just check the labs that he drew, make sure that everything, they checked for every single thing that it could be medically.
Okay.
And then maybe have you come back in about a month.
Okay.
All right. Do you have any questions?
No. You're gonna talk to my husband and my doctor. Do you think my sons might get this?
Anxiety? Well, I think that some of maybe what is causing it is your, how you grew up. Your mom kind of worried a lot. You kind of had a chaotic upbringing. Those are kind of the coping mechanisms that you had growing up. So I think some of it is genetic, but some of it I think that you learned some of the behavior. So that is what the counselor might be able to help you with, kind of like retraining your brain. You basically find out what triggers you, find out what makes you worry, find out what makes you have anxiety attacks, and try and stop that from happening. And it is more common in women, unfortunately. It's not to say that they wouldn't have it, but it's not necessarily that they would.
Okay. That was my only question.
Yeah, hopefully not.
I hope not.
Any other questions?
Nope.
All right. Thank you for sharing everything with me.
Thank you.
It was really good to meet you.
Good to meet you.